So when I started at Provide, which used to be the Abortion Access Project 10 years ago, I was lucky to inherit an organization that had been quite effective at expanding access to abortion care in the states where we were working. And we had used opportunities to identify new providers of abortion care among advanced practice clinicians, family medicine docs, to get them trained, to support them to become abortion providers, and expanded both the number of providers and the number of services in states all across the Northeast and the Northwest. We knew going in that the strategies that we'd used in places like Washington and Maine and Massachusetts were not going to work in the same way in places like West Virginia and Kentucky and South Carolina. And so we initiated a 5-year project, the Least Access States Initiative, to bring together stakeholders, activists, healthcare providers, and with a special emphasis on those that had not previously engaged around abortion, to look at the issue of abortion access project in the states and think about what kinds of solutions we might be able to support to increase access. And we had a 5-year period of a lot of exploration. We were doing everything from sex ed programs in the schools to developing practical support networks to the work that we eventually have focused on, which was helping health and social service providers counsel and refer for abortion care. But during that period of time, we encountered a lot of both success and challenges. And this report is really about where we encountered the greatest successes. We were able to work with a lot of fantastic partners and start some pretty innovative programs, many of which live on today. And even though our work at Provide has focused and has shifted away from that work, it continues, independent of our support, to make a real difference in the lives of people in these communities. The other thing about these groups, and one of the main reasons we're doing this report, is even though our direct work with them has had to end, they're doing amazing work, and they deserve the attention and the recognition and the support of our larger reproductive health rights and justice community.